our third cancer case in a day, Monday, Tuesday, Wednesday. So this is a nice patient, 67 years of age, who had the breast cancer in '08, ended up having reconstruction with tissue expanders. Then she ended up having implant silicone. And then in 2019, because she said that her time was up, she ended up getting them replaced. She was not absolutely certain if this were ruptured or not, but the discussion was that these were not, but it was about time that in 2019, they were 11 years old, they needed to be exchanged. So her symptoms started approximately 5 years ago, plus minus. She's one of the California patients who has moved here now to Michigan. And so she came, saw me last year and again this year, and now we proceed with the surgery. So she had bilateral mastectomy. She had right breast cancer. So I started off on the left side. And as you can see, this is the mastectomy scar. The stitch is at 12 o'clock. I removed the nipple areola complex. This is an oncologic operation. So the left mastectomy scar is indeed going to go, given the history of right breast cancer, and we want to rule out there's no malignancy there. So she had what was a nipple sparing mastectomy. This is the tissue that I removed on the side to help with the contouring. And you can see relatively very large implant. And I'm very happy and content with how the whole dissection has gone. Complete implant capsule removal below the muscle. Now what's interesting is she stated she did not have alloderm. I did not have the op record. So let's see what's on the inside. Very large implant sitting over a lot of ribs. So in my analysis, you have to look at the picture and the video of the chest wall. Very important. And this is like the completion video, if you will. So the other thing I want to point out here is if you look at this one, this implant, this is exactly how it was sitting on the left side. On the right side, it was actually flipped. So you can see it's this is how it was sitting, as it should be the other way around. So going back to the left side, 100% total capsulectomy. This is a very thin, I'll take the ruler. You can see how thin the capsule is. No matter how thin the capsule, it has to be completely removed. Because in my practice, we don't want to give this a chance. So we want to remove the entire capsule, and it's going to go for CD30 analysis, rule out breast cancer. And believe it or not, in the past they have found breast cancer within and proximity of the capsule. So here it is, the relatively very large, but I would say never-ending implant. And you can see this is your 685 allergen. And so as you will see, look at this. This is what is the leaching of the silicone, 685 intact, and you can see, look at the way it was sitting. This was kind of bunched up together, capsular contracture. Now what's interesting is if you look carefully over here, there is this nylon suture, nylon. This is clearly a nylon suture. Interesting. That was within. I never use nylons. I don't even have them in the operating room. So nylon suture noted. And then as I go and look, here's another nylon. Look at this. This is, again, removing anything abnormal related. And so here's suture. You can see this is a permanent suture, nylon, black nylon suture, everything removed. All inflamed tissue removed. And as you will see right here, this is nylon suture, more nylon suture. And if you look at this patch of white patch, so I'm going to go ahead and put this here. So again, if you look at the implant right here, you can see how it's quote unquote bunched up. And this is how it was kind of, if you will, contracted inward. So I'm going to go ahead and send this left mastectomy scar separate, left breast implant capsule separate, and I'm going to take cultures from right around here. I'm going to go ahead and change remove my top sterile glove because I don't want to cross-contaminate, especially when she has history of breast cancer on this right side. And as you will see right here, this is your native nipple areola complex right here. I'm going to flip this around. The orientation is 12 o'clock, so this is lateral, medial. And you can see the area in the middle is the most attenuated, if you will. And per story, she had what was a free nipple transfer, so they removed the nipple, and then towards the end of the case, replanted. For contouring purposes, this is the part on the skin that I removed. And as you can see, a relatively very large implant right here. And I'm very happy and content with how the whole dissection has gone. And I'm going to cut this open. Very thin capsule again, so if I put my finger here, you will see complete total capsule removal. Saran wrap pen, and this is your 640 Allergan. And again, just like on the back, if I go, look at this. Leaching of the silicone from the silicone shell of this implant. You can see very slippery. And you can see, look at this, how it's like a fish mouth appearance. If I go like this, you're going to see how it wants to just sit like this because it was compressed inward. Very large implant, and you can see it's a little bit on the yellow side. And so capsule again relatively very thin, some areas relatively thick. Look at this, how thin this is. Complete entire implant capsule removal. Now if you look at this, look at what is suggestive of this white band right here. And seen this before, you can see how thin this fatty tissue is, the capsule tissue is. If I go like this, so that yellow fatty tissue is as involved as the capsule, because the capsule is so thin, because this is where this has reached into. So as you will see, the implants will be returned to the patient. Capsules to be sent to pathology, right and left breast implant capsule separately. CD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology, rule out breast cancer. Cultures for aerobic, anaerobic, and fungal within the capsule. Right and left mastectomy scars to be sent separately, given the history of right breast cancer, and certainly given the fact that she has her own native nipples. She certainly has had the propensity to get breast cancer, and she had a history of what is DCIS, ductal carcinoma in situ. So overall, complete thorough workup. We'll see how she does. I'm sure she's going to be very relieved just getting the weights off her back, given her age of 67, and plus the other signs, symptoms suggestive of what is breast implant illness. Complete thorough workup. No need for drains. She's going to get what is a flat chest aesthetic closure, and there you have it. This is Dr. Khan, Executive Plastic Surgery.